Hello all. Today we are going to discuss about the topic hemorrhage. I am Mrs. Golden, working as tutor in M College of Nursing. At the end of the class, we will be able to discuss about what is hemorrhage, what are the types of hemorrhage, and enumerate the causes of hemorrhage, what are the classification of hemorrhage, and what are the classes of hemorrhage, enlist the signs and symptoms of hemorrhage, and what is the control for the external hemorrhage, and the first aid treatment of internal hemorrhage. So definition: the term hemorrhage refers to excess loss of blood due to rupture of blood vessels, or in a simple term we can say it as loss of blood from the body due to any injury. So there are two types of hemorrhage. First one is the internal hemorrhage. So internal hemorrhage is referred to as the loss of blood inside the body due to any rupture of the blood vessels. So next type is the external hemorrhage, where it is referred to as the loss of blood outside the body due to any external injury. So under external bleeding, we can classify of three types. First one is capillary, second one is venous, and third one is arterial. So under capillary external bleeding, there is a slow and oozing out of blood. Bleeding can be easily controllable and it stops spontaneously. So under venous external bleeding, there is a steady, rapid flow of blood. It can be easier to control, and there is a low pressure system in this venous external bleeding. And last one is arterial external bleeding. There is a rapid and profuse loss of blood followed by palpitation and increase in heartbeat, and which is most difficult to control. So there are many causes of hemorrhage. The first cause will be the wounds, where there is a break in the continuity of the skin. And second cause is the incised wound. Incised wound is nothing but if there is any cut with the sharp objects. Second cause is the laceration, abrasion, contusion, if there is any punctured wounds, or if there is any gunshot wounds. And there are many other causes where we can classify as any fracture of large bones, and during intra-operative period, and if the person has met with any road traffic accident, and if there is any blunt traumatic injury, invasive diagnostic procedures, if there is any anatomical defects, if there is a canine bite, or if there is any crush injury, and the last cause is the varicose bleeding. So here I have displayed some pictures for the causes. This picture is the incised wounds. Incised wounds is nothing but if there is any cut with the sharp objects. So this picture indicates the gunshot wounds. This picture is if the person has met with a road traffic accident, there is a rapid bleeding. This is laceration. This is contusion. And this is abrasion. So these are the classification of hemorrhage. According to World Health Organization, grade 0 where there is no bleeding, grade 1 there is a petechial bleeding. Petechial means mild tiny spots of bleeding under the skin. Grade 2 is mild blood loss, and grade 3 there is a gross blood loss which requires the transfusion of blood, and grade 4 is there is a rapid debilitating blood loss followed by retinal or cerebral associated hemorrhage, which will finally lead to fatality. And these are the classes of hemorrhage. Class 1 hemorrhage, it involves up to 15% of blood volume, and class 2 hemorrhage, there is 15 to 30% of total blood volume required. Class 3 hemorrhage, here there is a loss of 30 to 40% of circulating blood volume, and under class 4 hemorrhage, it involves loss of more than 40% of circulating blood volume. These are the signs and symptoms of hemorrhage. So at the earlier stage, there will be the signs and symptoms like restlessness and anxiety, feeling faint, coldness, pallor, and patient feels thirsty. And when there is a severe hemorrhage, and what are the signs and symptoms that can be noted? Extreme pallor, child sensation, air hunger, ready thready pulse, extremely high blood pressure, extreme thirst, diminished urine output, blindness, tinnitus, and coma, which will finally lead to death. So this is the control of external hemorrhage. So first management is the pad, which is a simple method by applying a direct pressure to the bleeding wound, and it causes no damage, which is effective. And the second management is a digital pressure. In this, there is a pressure applied directly at the point of artery which is supplying blood to the area of wound. This will control the hemorrhage temporarily, but it is an indirect pressure. So third management is the elevation of limb, which will control the venous hemorrhage. And fourth management, application of tourniquet. So a tourniquet must be tightly applied in the case of sudden emergency. The tourniquet must be 3 to 4 inches wide, and if the tourniquet remains in the same place for more than 30 minutes, gangrene occurs in the limb. Next management is a surgical ligation. It is necessary when the bleeding is persistent. And next one is a coagulation. So under coagulation, we must coagulate the blood from the small tiny blood vessels. So this is the first aid treatment in case of severe internal bleeding. So we must lay the patient down with the head low, and we must raise his legs by using a pillow. Keep the patient calm and relaxed, and you must reassure him. And do not allow the patient to move. You must keep the patient's body heat with thin blankets or any coat. You must not give anything to eat or drink because aspiration occurs. And we must not apply ice bags or hot water bags to the chest and abdomen places. And we must take him to the hospital as early as possible. And while transporting the patient, we must transport gently. And finally, conclusion. So at the end of the teaching, we can conclude that hemorrhage means the escape of blood outside its containing vessel. So whenever a patient is hemorrhaging, either externally or internally, there is a rapid fluid volume deficit and the decreased cardiac output, which will result in the reduction of circulating blood volume, and this will finally lead to the primary cause of shock. So fluid replacement is essential to maintain circulation. So these are some references I have quoted here. Thank you all.